I would like to acknowledge the traditional custodians of the many lands on which we meet today and pay my respects to elders past, present and emerging.
So I'll get started. I'll tell you a little bit more about me. Now just check, Michelle, you can see my slideshow.
Yes, it's all looking good.
Oops, hold on. It's just decided to unshare it. Let me just try that again. Technicalities, there we go.
There we go. Yep.
There we go, that's better. Okay, so these Speechy Library Talks, they are an initiative from Speech Pathology Australia in collaboration with the Australian Library and Information Association. Our aim is to try and help support and strengthen your child's language and literacy skills. As speech pathologists, we know all about language and literacy development, and your local libraries know all about the books and the resources that are available to help this development that is at your disposal, both in terms of books that you can use, but also programs that your libraries will often run that also help support your child's development. As Michelle said, my name is Laura and I am a certified practicing speech pathologist and I've been doing it for a long time now. Part of my role is to support children and families and their early childhood educators at preschools and any other professional that may be working with that child on their language, their social skills, and of course their literacy skills. And reading with children is a very, very important thing. For me, this talk is fantastic because the 0 to 3 range is a bit of a passion area for me professionally, but also personally. I am a mum, I've got some young children myself, and I love seeing how a child's language develops right from birth and as they get older. And we feel here at ACM that this is an area that parents need to continually be educated and provided information so that you guys can help support your own child's language and development. You can work on building your child's literacy and language and social skills right from birth. And it's an area we are becoming more and more knowledge about professionally and also trying to spread that message out there to other families so that they know what they can do to help their children. So what is a speech pathologist? This is something that people often get a little bit confused about. They think that speech pathology is just someone that may help on their sounds, helping someone to talk. But there is so much more to our profession. It's actually quite a diverse profession. We can work on the production of sounds and building up someone's ability to articulate themselves appropriately. We work on a child's language, and from language that can be their expressive language or their receptive language as well. We need to build both sides of their language up. So our receptive is looking at our understanding of instructions, of sentences, of grammatical forms, of questions. Our speech, our expressive side is looking at our speech, how we construct sentences, how we use those grammatical forms, our vocabulary, all that makes up our conversation. We can work on literacy skills. So that's right, those early literacy skills like rhyming and syllables, and right up to those school age literacy skills such as spelling rules, blending and segmenting, reading comprehension, questions, all those things that come with the literacy. We also work on voice, children and adults who have voice difficulties, swallowing if there's some areas of difficulty. We can work on fluency, which is looking at a child's, whether they're stuttering or not, and looking at the fluency of their speech. And another huge area these days is social skills and looking at the child's ability to play, engage, have conversation, eye contact, be able to regulate their emotions. All that comes under social skills. We work with families to help them achieve their goals and to advocate their needs as well. So it's really important if you are working with a speech pathologist that we all work together so that these goals can be met. Our role in literacy is important. It is an area that is extremely important. You can't have any subject at school without literacy, whether it's PE, whether it's art. You need to have literacy in there because you need to read and you need to spell in all things that you do. So reading and writing are really important, and they are linked to language skills as well. So it's important that we make sure your language as well as your literacy skills are developing so that you can participate in everyday activities. Speech pathologists can help you with your language and your literacy skills by building on those foundations for you, building on those early language skills, those early literacy skills. And then we can also work on building them if they are delayed or you're having trouble with them. We play a vital role in child's sound awareness. So that's understanding of sounds. and their language skills. So making sure that they can understand the letters and sounds in the alphabet, that they know what to do with them, that they can blend them and segment them together to make words and to read and spell. We also play a big role in diagnosing or assessing children that may be having difficulties with their literacy. So we'll often have, once a child starts school, we will have a teacher refer students to us to have a look at their literacy skills, to look at their reading comprehension skills, to see if we can find out where that breakdown is happening, where those difficulties are occurring. So why is literacy important? There are very strong links between good listening, understanding and speaking skills and the successful acquisition of literacy skills. The research is showing that it is very strongly linked. If you have strong language, you're going to have an improved ability to have stronger literacy skills. Language difficulties in preschool may then predispose a child's ongoing reading difficulties throughout childhood and adolescence. So if there is a child at preschool that's having trouble with their vocabulary or using sentences or understanding sentences, we know that they are at a higher risk of later having literacy difficulties. If a child has speech sound difficulties, so if your child's not pronouncing all their sounds correctly as they get older and are at preschool, we know that they have a higher risk of having literacy difficulties because those sound difficulties then can impact their ability to blend and segment sounds when they're working literacy-wise. So literacy is very important. Reading and writing is an essential part for participation in everyday life activities. You have to think about everything you do within your daily life now as an adult, and everything involves some form of reading or writing or spelling, no matter what you're doing, whether you're trying to watch the TV, whether you are writing some things down, whether you're filling out a form, when you're at the shopping centre looking to buy things, you need your literacy skills. So reading books with your child now, right from the beginning, right from when they're born, can help set them up for success with mastering these literacy skills. So today we're going to look at ways to build our language and literacy skills. We're going to look at them in some general ways, but then we're also going to look at them in some specific ways for that 0 to 3 age range. So let's talk about some of the 3 main areas that you can help at home to support your child's language and literacy while you're reading a story with them. So the really key factors that come when you're sitting down and having a look at a book is 1, the choosing of books. 2, the encouraging interactions that you're having with them. So making sure they are an interaction. It's not just about reading a book. It's actually a whole experience. And keeping reading a fun part of every day. We want reading to be fun. We don't want it to be a negative thing. If it is a negative thing right from the beginning, we're setting literacy up as being this negative barrier. It's something that I don't enjoy doing. It's hard, it's difficult. So we want it to be fun. So when we look at choosing books for children and we look at that birth to 3 year range, we need to think about babies. Now, babies who are little, they're tiny. We think, okay, how can I even be involved in getting them to read books? But you can, right from the beginning, as soon as they're born, you can start introducing them to books and to their literacy skills. Infants really is a great stage to foster that love of reading. Now, babies are very little. They do like to mouth all their toys. They like to put the books in their mouth. They don't know how to turn the pages. Their attention span is very, very low. You may be concerned that they're not actually engaging or interacting, but they are. It's about choosing the right books. So when we look at a baby, we want to look at our books being those really hard cover books, those books that they're quite thick cardboard pages, or the cloth books. You can buy those books now that are material books that have, little things that you do or you move around in them that you open up. You can look at plastic books. There's often books that you can take into the bath or ones that are purely plastic. There's material ones that often have hooks that you can hook onto a pram. All these are appropriate for those really little babies that are wanting to mouth all their books. Books that are bigger and colourful, there's not as much happening on each page. So wanting there to be only a small amount happening on each page are important for that 0 to 3 range. We want them to be able to engage in it. And if there's too much happening, then it's overwhelming for them. And interactive books are also really important. So books that have our lifts, our flaps, like our spot books, or our Dear Zoo books, or looking at books that you can press and it makes a noise and does things, are also really important because it gets them involved in that experience. So if your baby is putting the book in their mouth and they're biting it, it's okay. That's appropriate. You don't need to panic and think they're not enjoying that time. That's actually an appropriate developmental stage for them. So it's not something you necessarily need to discourage. You just need to think about what books you're giving them. So if they are doing that, it's appropriate, it's okay. So when we are giving them these books, we're giving them the appropriate type of book. We've got ones with nice big colourful things. We've got ones that haven't got too much happening. We can then be the ones that are actually more telling the story. We are the ones engaging with them, making noises for the things that are on the page. If there's animals or trucks or cars, we're pointing at little things to draw their attention to things. And it's really important to remember, because their attention span isn't huge, it's not going to be a long time. You might be just looking at one book. You might be there and looking at a couple of books. Each child is different, depending on how long they will sit. But it's okay if your experience is only 2 minutes, where someone else's might be able to sit there for 5 minutes. It's a matter of building on that experience and making it a valuable experience. And over time, you'll see that attention span increase. So encouraging your baby to interact with you. How do we make this an interactive experience? Well, we need to strengthen their language skills. Reading is about building language, and language is about building literacy. They work together. They tie in together really nicely. So to encourage your baby to interact, you can think about, all right, how can we position ourselves? It's important that you are sitting at their eye level. So you might have them, you sit here and they're sitting in front of you so that you're looking at them, you're facing the baby, and as you're pointing to things, they can see your facial expression. They can see you engaging and being having quite alert emotions there. You might be really excited or really scared in a moment. You might have the baby sitting on your lap and the book in front of you because they're not yet sitting. So you need to support them. And then you're sitting together and you're using your finger to point and to show things. You can also look at positioning yourself sometimes in a place that might be in the high chair, or you might be out and you'll be in the pram and you're sitting and you're looking at something together. Reading doesn't have to be always in the same place at the same time. You can have your routine where you do read a book every day at bedtime or every morning after they're just woken. But it's also important to include books and literacy in all other times of the day as well. So they realise that this is an experience that you can do anytime and it is enjoyable. It is important to let your baby have a turn of the book. So that's why we're picking those books that are okay to give to them. So you don't have to panic about them tearing it and ripping it, giving those hard books, those books that are plastic, that are material, so they can have a turn holding the book, trying to manipulate the pages in the book and turn them, trying to lift some of the flaps. They always think that's exciting. Pushing the buttons that are in those books that make noises. All these things make it a very interactive experience for them. The books that are very popular these days are the That's Not My Car or That's Not My Dolly. Those books are great as well because they're hard covered. They've got things in there that they can touch. They've got the soft, the bumpy, the squishy, all those different surfaces that little ones love. It makes it an engaging experience and you can use a lot of language. So supporting language learning, how do we support their ability to take that book and learn from it? Instead of it just being a time where we're reading a story to them, how can they actually learn things from it? So pointing to the pictures in the book is a really good way as well. So if there's a bird in the book, for example, you might point to the bird and go, oh, look, a bird, tweet, 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 tweet. That we might do if they're quite little. If say your child is 18 months, 2 years, you might start to go, oh, look, a bird, tweet, tweet. Oh, look, the bird's sitting. Oh, look, the bird's flying. You're going to add some more language to that interaction. So you need to think about your age of your child, and that will dictate what you're going to do, the language you're going to use with that story. A good rule we use in terms of language development is you're always one word above what your child is doing. So if your child is not yet talking, they're too little to talk, then you're just going to be using single words. It's going to be really, really simple language for them to be able to understand it. It's going to be single words. It might be more sounds. It might be more pointing, more trying to get them to touch the textures. If your child is using single words, then it might be about using words. So it might be, oh, look, a bird. Oh, look, a bluebird. Oh, look, the bird's flying. We're trying to add to their language. We're trying to give them more vocabulary. We're talking about descriptions. We're talking about actions. We're talking about locations. We might, as they get older, say they are that 2.5 to 3 year, we're going to try and use little sentences. Oh, look, the bird's in the sky. We're showing them how they can grammatically put a sentence together. We might even start to ask them some questions. Where's the bird? Or who's in the box? Or, uh-oh, what's Spot doing? You need to think about the age of your child and what language they're using and use that to help you with what language you're going to use when you're reading the book to them. So you might have your child respond with some babbling noises when you're doing the book. They might start to go, if there's a sheep in the book and you've just done bar, they might be trying to copy you. They might not be doing a lot of babbling or a lot of noises, but you might get that smile. You might get that finger trying to touch the book to show you that they're engaged and they're interested in what you're doing. They might even try and turn the page after you finish that. They know that something exciting is going to happen next. And that comes involved with that it's really important to do repetition, to not always have a different book every day. It's okay if you read the same book, 3 times that day. If it's the same book each week, whether you have 3 books you're going to read that whole week. I'm reading a Spot book, I'm reading Dear Zoo book, and I'm reading That's Not My Car book. And you're using those 3 books because you're going to keep using similar language, and it gives your child that opportunity to learn that language, to attempt to be able to use their own language, to engage in that experience and to know what's happening next. That's how they like to get involved. I know when my little boy was young, we had a Spot book, and it's a fire engine shaped Spot book, and it makes the fire engine noise. And we would read it together, and we had our own routine happening. He knew what was happening because we'd read that book quite a few times. We'd open the book and we'd say hello to the firefighter. We wave and we go, oh, hello, hello. Spot would wave hello. We'd then turn the page and he would see the hose and he'd go shh. He'd make the shh noise because he knows a hose makes a shh noise. So our next page was, oh, shh. And I would be saying, oh no, the hose, shh, we're wetting him. The next page, they're washing a truck. And we would go, oh, wash, 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 washing the truck. And we're using a verb there. We're building on their action words. And then the last page was where the siren would come on and we'd push the button. So I'd go, oh, push. And we'd push the button and then we'd say, bye-bye. And he'd know that routine because he'd had that book. We'd had that repetition. And it wasn't about me necessarily reading the story. Sometimes I would read the story, but it was about me making my own story up through that book that was appropriate for his level. And that's what you can do at home with your own children. Have a look where they're at, where their language is at, and you can tailor that book to suit them. And that's okay. It doesn't have to be you reading the whole story. You'll often find if you're trying to sit there and read the story as it is to someone that's not at that age level, that's where their attention will go. They'll disengage. They won't want to get involved. They want you to be engaging. They want you to make this quite an interactive experience. But it is important not to test them. The book isn't about going, oh, what's that? Where's that? Oh, who's that? In a very testing sort of way. It's okay to ask questions, but we don't want to ask too many questions. And if we're asking them, we want it to be a fun way, more as though we're lifting up a flap in the book or trying to find someone in that situation. So choosing books, I've sort of talked as we've been going about some of the good books that are out there, but there is so many books out there and your library will be able to really help you with this because they have them in age ranges, in groups in the library. They have experience with what the good books are, what kids are interested in. They use these books in their programs that they run. So you can definitely ask your library what books they would recommend for your child and their age range. But you need to think about picture books for the short story. So that if they're little, 0 to 3, we want the story to be short. We want the books to have a couple of sentences per page so that it helps you, give you a little bit of content if you need it sometimes. And it's not just about us labeling. It's not about the book being, oh, I'm just going to point every label out all the time. Sometimes we might do that, but we do also need to add content to it. Like with that Spot book, I entered the content of we're saying hello, we were washing the car. I made a story up in line with what the story was and the pictures, but I adapted it to where my son was at and what level he was at. Books Books also need to include words that a child can hear in their everyday life. So it's important to have words that are common, but also important to have words that are less common. We want a mixture. The story time is about you being able to understand it and know some of the content, but it's also about you trying to learn from it. So if you were to pick a book that was about space, they may not know the word astronaut, but they may know the word moon. You may at times go outside at night with your child and say, oh, look, there's the stars, or look, there's a big moon. You're then going to pick that book and you're going to use the words they already know within your storytelling, but you're also going to be able to expose them to some new words. Oh, look, who's he? He's an astronaut. And you can teach them some new vocabulary. How can we encourage these interactions? So as we said earlier, make sure you get your child involved. It's not about you being the only one involved in this experience. They want to be involved in it too. So let them have a turn at holding the book, turning the pages, talk about the pictures together, see what they're interested in. Where are they pointing to? Are they pointing to certain things on the page that you could add some language about? You can discuss how it might be related to you or interest in your own child's life. Point to words as you read them. If your child is 3, you might actually point out some of the words in the book. You're going to talk about the sounds in the book. So when they're little, it's going to be about sound play. Ba, ba. As they get older into that 3 to 5-year-old age range, it's going to be about identifying some more of the sounds. D for dog. D, oh, that's a D sound. So even though we're looking at the 0 to 3 range, this little slide here is about teaching you how reading doesn't stop. It keeps developing. From 0 to 3, it's one type of reading with your child, but as you get older, it becomes another experience. And we need to keep adapting and building based on where our child is at. Keeping reading fun. So it needs to be part of your day. It needs to be part of your everyday if you can. Life is busy, so it is hard to fit in, but that where if you can be flexible at times, then you can include it sometimes in a whole range of activities. You can make it part of an everyday activity. So it could be bedtime routine, it could be morning time routine, it could be when you go out for a walk to the park that you pick a book and you sit down for some quiet time after playing. You can choose what suits you and your life. The more you read though, the more predictable it becomes. If you start this experience right from the beginning, as soon as they're bored, then you sit down and you look at a book together and you have that time, it will become a routine that they enjoy, that they expect and that they want part of their day. And they know that they can learn from it and they can enjoy it. Make it fun, make it a fun experience. Don't feel worried about making the silly noises or doing the silly actions. Those are actually what they really enjoy when you're reading a book with them. And it's also important to think about your child's interests. So you can expose them to new books and to books that are appropriate for their age, but you also need to think about things that they're interested in. So if you have a son, my son was interested in diggers and very obsessed with diggers as a little one, that we would have more books that are about building and construction or had things to do with that. Where my daughter enjoyed pretty things or house things or baby things, so I might read books that were more tailored to that. So you need to look at what they're interested in as well as what's appropriate for them. You want to aim to read by the time they're 5, we want to work up to being 10 to 15 minutes. But it's not going to be that long right to begin with. It's going to start really simple. It might just be 1 minute looking through a book. Then it might get eventually to 5 minutes and then eventually to 10 minutes and eventually to that 15-minute time. Could be even longer if they're really, really engaged and enjoying it. But don't stress about it having to be a really long time right from the beginning. We want to build on that time and you need to take it from your own child. If they are starting to lose interest, try and make it a bit more exciting, a bit more interesting to see if you can get them back involved in that experience. And if you can't, then it's okay to move on. Try again the next day or try again later on that day. We don't want it to become a negative experience. So my child is already reading. Okay, so as your child gets older, you've got your little ones now, but they will eventually start to read and want to read themselves. And this is when you can help them by encouraging them in your everyday environments. You can get them to look at your shopping list, read street signs when you're out and about, look for letters that match a letter they may be learning. If your child is reading, it's still really important that you do sit with them. As they learn to read and they can start to read books on their own, doesn't mean that you don't have to ever sit with them. It's important that you do sit with them still sometimes so you can keep monitoring their reading, keep scaffolding their learning. So if they are doing a great job reading it, you might start to ask some reading comprehension. Oh, why do you think they did that in the story? Or what do you think might happen next? Or how do you think they're going to solve that problem? We can help them build on their literacy skills, no matter whether they're reading or not reading. Okay, so today you are your 0 to 3 month old age range. It's really important for you to know your child's communication milestones. And Speech Pathology Australia has some beautiful milestone charts, which you can get from their website, but it's also been included in a little pack that I'm not sure whether Michelle has distributed yet or is yet to be distributed. But I have put this chart as a document in a little pack for Michelle so that you guys have this at home. And it helps you to work out whether your child is meeting those general milestones. So remember, milestones are an average range. What they're looking at is the average of what we want to see. You know, we know there's going to be some that are a little bit behind, that are not quite there yet, and there's going to be some that are already there and doing even more than that. But we're looking at that average, and that's what we're sort of trying to look at. So it gives us a guide then to see whether our child is struggling or needs a little bit of assistance at all. Hold on. So if your child is having difficulty, what can you do? Speech pathologists are here to support you, and we're here to help you and to work out whether your difficulties are something that is normal, because there are some difficulties that are normal at certain ages and then they progress and they then start to do the age appropriate. I think there's some difficulties that are no longer age appropriate or are not normal difficulties and they do need to be looked at. So it is really important that you do get your referrals early. The biggest thing we can say is early intervention is key. The sooner you work on areas that you're concerned about or you're worried about, even if it's just assessing it, means there's a better outcome in the long run for your child. We really think it's better not to just wait and see. It's not the idea of, oh, but I knew a friend who didn't talk and then all of a sudden they started talking. They can be the abnormal. They're not the normal. If you are concerned or you know your child's not meeting those general milestones, that's when you do need to have a chat with someone, whether that's the childhood nurse, whether that's your GP, whether it's just reading a speech pathologist straight out. You don't need a referral to see a speech pathologist. So you can go and see a speech pathologist privately without a referral, and you can go and see one through community health as well without a referral. Be mindful, private and public speech pathologists these days have huge waiting lists. So if you are concerned, it's better to ring up and put your name on a wait list. And then if your name gets called and those concerns are no longer there, fantastic, you don't need to worry about it. But at least you've put your name onto that waiting list. If you don't know where to go, who's in your area, don't know anything about it, Speech Pathology has a listing on their website where you can find speech pathologists in your area and that specialise in paediatric caseloads. So if you are concerned or you look at those milestone charts and think, oh, they're not quite meeting those averages, it's okay to call someone and have a chat and see if it's something you need to investigate further. All right, now today we are also here to talk about our 2021 Book of the Year winners. And each year, Speech Pathology Australia picks a book of the year as a winner. And they pick it in different age range. So we have from birth to 3, which is our Look Baby, is the winner this year. From the 3 to 5-year-old age, it is Boo Loves Books, who is the winner this year. And in the 5 to 8-year-old range, it is The Thing That Goes Ping, is the book winner this year. So, as you mentioned earlier, your librarian can really help you with these interactions. They can help you to be able to pick what's going to be appropriate. Librarians have a wealth of knowledge. They know a lot about books. They know a lot about literacy. They know how to engage a child in books and in reading books. So you can ask for help to choose books, to choose appropriate books. They can help you find certain ones that are on a topic that your child may like. They also have a whole range of opportunities of activities you can attend. I know on the coast, we're really lucky that they run different types of activities with different age ranges, right from birth up to just before school, which is where I'm going to hand it over to Michelle now. We had a little chat the other day and there is so many good programs available that she's going to mention some of those to you guys so you know what's available.
Yeah, absolutely. Thank you, Laura. So yeah, as you mentioned, we do have some fantastic early literacy programs, from birth. So obviously things have moved online over the past few months. So at the moment we are running a baby time, which is in particular targeting 0 to 2-year-olds, and that runs every second Tuesday online. And that, along with reading a story, we also do a lot of kind of singing and rhymes and actions, which are another great way to really improve and expand babies and children's vocabulary, looking at communication, and it can be really a kind of bonding experience with your child as well. So they're currently online every second Tuesday, and there's lots of details on our Facebook group if you'd like to know more about that, or you can get in touch with us. And so then we're also running at the moment a story time, which is more for the kind of slightly older 3 to 5-year-olds, and they're every Monday and Wednesday, and we're also, along with reading a story and singing some songs, we're also doing a bit of a craft activity as well. So we are hoping early next year to reintroduce our face-to-face programming and to kind of start up those early literacy programs back in the branches. So we'll have a baby time, and then we'll also have toddler time, and then a story time as well. So just keep an eye out on the library's webpage, and also the website, and also on our Facebook pages as well, and we'll keep you updated with those. As Laura said, we also obviously have lots of wonderful, wonderful books. Please do ask us for recommendations, or just come in and have a bit of a browse. We do have most of the shortlisted books on the Book of the Year Awards that Laura mentioned. And the other thing I just wanted to mention is that it's never too early to get your child a library card. Getting a library card really early on, it can be really exciting for children. They have a real sense of pride, a sense of ownership, and a sense of responsibility as well. Like, look, I've got my library card and I need to look after my books, but also, isn't this special? I'm going to get some books to take home. And also, it helps to kind of make it fun as well, and exciting. So as Laura was speaking about, let's make borrowing books fun. Let's have a special library bag and go off and, what are we going to choose this week? So that's some of the things we have going at the library. We also have school holiday programming as well, and special programming that comes up throughout the year. So we'll obviously be promoting those on our website and on our Facebook groups as well. But yeah, if you're not a member of our Facebook group, please do join. It's a great place to kind of keep up to date with what's going on. And yeah, if you do have any questions, or you are after recommendations, then please do get in touch with your local library. We'd be more than happy to help you.
Perfect. Well, that I'm just going to come up to back to the screen. You guys can see it. Oops. Oh, it looks like it's gone back to the beginning. Oh, no, there we go. Beautiful. That brings us almost to the end of our talk, and then we've got some question time. But it is important, if you do want to know more about your child's language and literacy, you've got your library there as a great resource, but also Speech Pathology Australia do have a resource section for the public on their website, where you can go and you can find some fact sheets and some more information, such as those norms, such as what speech pathologists do. You can find a speech pathologist, and a few other little handy fact sheets and different things like that as well. It is really important. I know Michelle has sent you guys out, if you registered, a little pack. If you haven't registered, then please let her know, and she will then be able to send that out to you. In your pack is a little brochure from us at ACM to let you know a little bit more about us. There is the communication milestones from Speech Pathology Australia. There is a nice little speech sound milestone as well for your child's articulation. And there is some information specifically for this age range, that 0 to 18-month-old range, that we're really excited. Very similar in a way to what the library runs, but we are starting up a play group. We've been waiting to do it, but COVID sort of held things off for 2 years. So we're fingers crossed, all systems go next year. A play group that goes from 6 to 12 months and one from 12 to 18 months old, that is tailored to looking at building your skills and your strategies as a parent, and interacting and engaging with your child. And it's all about having fun with your child, coming and building on your ability to engage with your child and build their language and build their social skills and build their sounds from a really early age, and having a nice supportive environment with other parents that are at the same age range, but also making contact and making a contact with a speech pathologist. So if you do have concerns and questions, there's someone you can just throw some questions to at that time during the play group. So there is some information about that as well in your pack. But I am going to thank you first for all coming along today for the talk. I really, really appreciate that, because it is so important for you guys to keep building on your skills and your knowledge. It is something I know as a parent, that if you're not in an area where you know about this, then you don't realise how much you can actually do to engage and build on your child's language and literacy skills right from the moment they are born. So follow the library page for knowing about all those groups and activities on there. Social media is a really good thing for that, to be able to expose us to different things. Also in our pack, it talks about our Facebook page and our Instagram page. Have a look on there as well, because that helps you learn things as well. We often put tips and strategies and different things up there to help parents out, because it is a minefield out there being a parent, and trying to do the right thing and trying to know everything is really hard. So it's really important to know where you can go for information if it's not your area of expertise. Now, we have had some questions already come in prior to the talk that Michelle has put together for me. And we also do have the chat box here on Zoom. So if you haven't sent any questions through and you have got questions you'd like to ask, you can type it in the chat box, and we will monitor those, or you can turn on your camera, and unmute, and you can ask it directly if you want. That's not an issue for me either. But we are going to answer some of those questions that have already been sent through. I'm just going to open those in another document, sorry. Do you have them in front of you, Michelle? Oh, I've got them actually.
Yes.
All right, I found them.
Them.
Okay,
Okay,
yep,
great.
Just pulling up my other device. Here we go. So I'm going to start with one question that's come in, that their child has got post-grommet surgery. So they've had a grommet, which is very, very common. Lots of kids have grommets. How do I correct the pronunciation of words that have been incorrect for a long time now? This is a really interesting one, and it does depend on what age your child has had their grommet put in, because that can dictate a little things as well. So some children are lucky that they get their grommet put in really, really early, that they only miss a little bit of exposure of speech and language development, so they can catch up quite quickly and start to hear those sounds correctly and be able to do the pronunciation. If your child is getting their grommets a little bit older, around that sort of 3-year-old range, then they've missed quite a big bit of hearing in terms of all those sounds, and they're actually then going to be a bit more delayed with that pronunciation and where they should be at with their sound development. One of the things we find is with grommet is that a large majority of children that have grommets will need some sort of speech therapy to help with their pronunciation. It's not because they all of a sudden can now hear and then they don't know how to do it. It's because when they couldn't hear, their oral articulators have learned to produce the sound a certain way based on how they've heard the sound. So say, for example, the k and the g sound, they might have learned to say it as a t and a d sound, and they're made completely different in your mouth. One sound is made in the back of your mouth, one is made in the front of your mouth. So you need to retrain your mouth on where that placement is needed and how to make the sound. So what I can say is it will depend on the age of the child. If they've got their grommets and they're like 12 months, 15 months, which is very rare, you kind of often have to fight for that as a parent to know that they really need it or it to be quite significant. But if they are younger, they've probably got more opportunity at being able to catch up. You want to do a lot of sound play. You want to emphasize the sounds that they're having trouble with, monitor it really closely. And if you're still concerned, then look at going and getting it investigated. If they're a little bit older, I would recommend it wouldn't be a bad idea to get it looked at. As we said earlier, early intervention is key, especially when it comes to speech sound production, because we train our mouth and our articulators on how to make a particular sound. So the longer it goes, the harder it is for us to retrain it, but to know where we need to go to make those sounds. And I would say we generally see 80 to 80, maybe 80% of people that have grommets at some point will go to see a speech therapist and have work on sound production. ENTs don't always recommend to go and see a speech pathologist. It is an area that really should be recommended, because you've naturally missed hearing, you've naturally missed how you produce those sounds. And the sooner you get onto it, the better. And it's also important when they do have their grommets that you're monitoring that they are now hearing okay as well. Has the TV been reduced? Are they hearing better now? They're hearing those sounds. Are you trying to make those sounds a little bit better? But if you're concerned and they're still not changing it, and you're saying they're making those sound areas for quite some time, I would say you need to refer yourself to a speech pathologist to get it looked at. It might just be some general strategies they need to give you. It might be that they actually need to start to work on those sounds specifically as well. That was one of our first questions. Hopefully that answers that person's question. One of the other questions we had was that my daughter is 18 months. She says a few words, however, she's mostly doing the tune or hum of a word. So for example, she will say thank you in a tune rather than opening her mouth. She often points to things and says instead of the word. Is there anything I can do to help her to develop her speech? Okay, so at 18 months old, we should be using a number of words. Use your communication milestone chart that I sent to you as well to have a look at later after the talk. But at 18 months, we should see quite a few words starting to develop, especially our routine things. By the time the child is 2, which your child is now at that upper end, getting closer to 2, we expect them to have between 50 to 200 words. So we're looking at that range. Some might not have a lot, some might have a few more, depending on the child and their overall development. And we also see it too that they're starting to combine words together. They're starting to do things like more milk or mummy down or dog barking or go fast. They're putting their words together. At 18 months, we should see that they're trying to actually use their language as their main form of communication. Even if their pronunciation isn't always there, they've started to work out there's a better way to communicate. So they might point at the fridge and go milk, or they might just say drink, and that means milk, depending on that child. But at 18 months, we should be seeing words to come along. We don't want to see that humming there. That is a normal development. When we're younger, we use the melodic intonation of the word. That humming is a really appropriate thing when a child is younger. When we talk, we often say it's good to talk to babies with that melodic intonation. Oh, we're running, or swinging, swinging, or oh. When we use that tone in our voice, it helps them to be able to try to attempt. They'll try and use the tone rather than the sounds of the words because they can't yet do that. But by 18 months, we should be seeing them trying to attempt to say those words. So they might not be able to say thank you, like in your example, but what we might see them doing is going thanks or going thanks, dropping a sound off there. You said that they're pointing to anything, often says instead of the word. So they're often going they might be pointing at it and going What we need to do is we actually need to start to require them to do a little bit more. We need to up the expectations that if they actually know that word, if they know the word milk or they know the word drink, that doesn't actually get that. You're going to model it for it. Oh, drink, and you're going to hold it there and you're going to wait. Drink, oh, drink, please. And you're going to want some sort of articulation. If they can't say the whole word, you might want drink, or you might want at least the gesture there with it, not just a open there. So there will be more coming with that. I would recommend you in that age range, if you're on social media, follow our new playgroup Instagram page. It is going to have lots of these sort of tips and strategies to build language on there that can help you at home. But I would be starting to just have a look at that communication milestone chart with your child at 18 months, seeing what they are doing and what they're not doing, and whether you need to start to investigate it further. And also, just like our last question, have a look at the hearing as well. If we're not hearing a lot, if we're not saying a lot, we want to always check that hearing out. It's really important to do that. They were my 2 questions there. I can see there's another one here in the chat box, that my 3-year-old son has childhood apraxia of speech. His speech is probably around that of a 1-year-old, 10 words. Should I be reading his books aimed at our 1-year-old? Really good question. So you already know you're already on that therapy track with your child if he's being diagnosed with dyspraxia, which is a speech sound disorder. So he's having troubles with the motor coordination of the sounds, being able to coordinate from the brain to the mouth to coordinate the sounds at times. I wouldn't say you need to necessarily always pick a 1-year-old book because if his language is okay, so if his language is age appropriate or not too significantly delayed, you picking a book that is really tailored for a 1-year-old. Okay, so he uses sign language too. Okay. So his language is then a little bit delayed. I would be picking, yes, sometimes those books that are for that younger range, but sometimes also putting in some that might be for a 3-year-old, because you want to also tailor it to his interests. Because sometimes those 3-year-old books might be centered around more things that he is interested in, like figures or cars and things like that. But the language you use and what you do in that interaction is going to be for his level. So like we did when I read that book there, you're going to tailor how you use that book based on your child's level. So pick some, yes, sometimes that are at that level to give him more chance to actually attempt to use language himself or to fully engage in the book, but also sometimes use ones that are at that 3-year-old level. So you can keep exposing him to more language and keep building his understanding, and you can then tailor that language in that situation. Does anyone else have any other questions? No? Perfect. If you do have any questions after the talk and you really are worried, our details are in that information pack there. So you can send us an email or try and connect with us and just let us know that you were at the library talk, and we'll know where you're coming from, and we can respond to that. But the biggest thing I can say to you guys with your littlies being that 0 to 3-year-old range is just interact, engage with them, have book time, have singing time, sing songs with music on, or when you're doing something. Play games that are people games, interactive, row, you boat, peekaboo. Make sure you involve them in your routine as much as that makes your activities you're sometimes slower, the washing, doing cooking, all those sorts of things. Even though sometimes that can make the day a lot harder or slower, it's really important to involve them in those things, even if it's not all the time, just sometimes, because those routine activities are what expose them to language, are what get them to use language in an everyday context. And you'll also notice if your child is developing normally, those everyday routines are actually where their play starts. So play skills have been researched to know that play starts very much as exploratory play first, wanting to explore things, find out what they do. Then it moves into cause and effect, wanting something that does something exciting. Then it goes into that sort of solitary play where they're playing on their own. Then we see some parallel play where they'll let you play next to them with the same sort of toy, but you're not actually playing together. Then that play starts to become a little bit more interactive, that they'll let you play cars together or tea parties together. And then you'll notice that you can actually go away. You can go and unpack the dishwasher and they'll play with the tea party themselves, because they're copying what you've done when you've done that together. Or they're copying when they've seen you have a party or had morning tea together, what happens in those interactions. Their play is shaped by what you do and the activities that they're involved in. So the biggest thing as a parent you can do is read, sing, talk, commentary all day in everything you're doing, even in the car. Oh, look, there goes a big truck. Oh, that's a noisy motorbike. Oh, look, can you see the sky? It's blue today. And involving them in your everyday activities at home. They're the most important things you can do, rather than flashcards or iPads or things like that. It's okay if you use those sometimes. They're not a negative. Everyone uses those, but they're not going to be your key language learners. Your key language learners are actually you and you interacting with your child. So go interact, have fun together. And if you do have any questions, please feel free to ask, and make sure you use your library. It is a fun space. You can get a lot from it. And I agree with Michelle's comment. My kids have always loved that experience of going to the library, picking a book, taking it home to look at, maybe showing dad once dad's got home from work. It become a whole experience, and a whole lot of language can be used in there from the moment you leave the house to the moment you get home from the house.
Oh, that's wonderful. Thank you so much, Laura. It's been really incredibly interesting to hear not only about children's language skill development, but also to get some really practical advice there on how we can help this process. And of course, that's something that we're really interested in and supportive of here at the library. So I think we've run out of time, unfortunately. So that brings our presentation today to an end. But thank you, everyone, for joining us. Thanks so much. And a big thank you to Laura as well for your time today. So
no, yes, thank you for having me.
I know it's been great to have you. So yes, as Laura mentioned, we have sent out some handouts, but if you haven't received those or would like to, then please do get in touch and I'll get those out to you. I just wanted to mention we do have another Speechy talk happening on Wednesday. This is going to be focusing on that older age group, the 3 to 6 years. So if you would like to attend this session, then we'd love to see you there as well. And you can book your place online, and there's also details on our Facebook group
I'd
as
recommend
well.
if you have the time, it'd be good to jump into that because then you can learn what you can keep doing as your child gets older.
Absolutely. Great.
Thank you.
Okay, well, look, thank you again, everyone, for joining, and thanks again to Laura, and enjoy your days, and we hope to see you all very soon, and hopefully see you very soon face to face in our branches for some wonderful baby time and toddler time and story time activities.
Wonderful. Thank you, Michelle. Have a good day. Have a nice day, everyone.
Thank you, everyone. Bye-bye.
Bye.